Today I'm going to be giving a very brief talk on inclusivity and neurodiversity and the role that researchers can play. The stereotype of autism is often a young white boy trapped in his own world and is seen as synonymous with intellectual disability. And it is assumed that autism is something wrong with someone, something that is broken and needs to be fixed. But autistic people are a diverse group, making up 2% of the world's population. And while autism can bring challenges, it can also bring strengths. And there is a growing push to embrace neurodiversity, different types of thinking and seeing the world, just like we embrace other types of diversity in people. Autistic people communicate and experience the world in ways that are different to non-autistic people. And it is often seen as those differences that are wrong and the reason that people are having problems. But often it is the way that society is structured for non-autistic people that is the problem. So what can researchers do to help? One way is to use respectful language. Most autistic people prefer identity-first language rather than a person with autism, an autistic person, just like it would be inappropriate to refer to me as a person with femaleness, as if being female is something that is separate to who I am, and perhaps implying there's something wrong with being female. We can also respect communication preferences. Even though face-to-face interviews are often held as the gold standard of research, particularly qualitative research, these can be quite intense for some autistic people in terms of the social demands of eye contact and reading body language, as well as sensory issues like lots of background noise. And so there can be a preference not to participate in this, which may prevent people participating at all. But offering different formats can help. These might include ways to participate verbally, like by phone, but many autistic people express a preference for communicating via computer for those who have access. So email and messages may be a way to participate in research in a way that autistic people are comfortable with. Another thing to think about is, who are you excluding? When you define your population, who are you including and who are you excluding? Because participating in research can be a powerful thing. One participant in my research looking at identity in relation to autism had never spoken to a single person about this. And just the act of being able to be heard is extremely powerful. And he was able to participate because I allowed for the space of people who weren't quite sure of their autistic identity, and I defined it outside clear boundaries of yes you are, no you are not. Another boundary that is very common is using diagnosis as a form of excluding or including. And what this does is it reinforces the idea that the medical profession gets to say who is or who is not. And it excludes people who don't have access to diagnosis, as well as telling people that they cannot define who they are. The most important thing, though, is to learn more. If you're interested in any of this, reach out, look at actually autistic voices, look up neurodiversity. There is a world to explore.